Good afternoon, everyone. This is Dr. Val Arkush, Chair of the Montgomery County Board of Commissioners. Today is March the 10th, 2021. We are in week 53 of the COVID pandemic here in Montgomery County. This week marks 1 year of Montgomery County battling the COVID-19 pandemic. I would like to start today's briefing by reviewing the key data indicators we've been tracking since the pandemic began. This chart shows the journey we have been on for the last year. Let that get up. It illustrates our spring 2020 peak, followed by our summer 2020 low, then the rise in this past fall, and finally to where we are today. Tracking this data over the last year has provided us with the insight to be able to navigate through this pandemic and put into place public health measures to keep our community safe. To this day, our team still meets several times per week to go over these numbers and to make sure our strategies are working to suppress this virus. The gray trend line shows the 7-day average of our cases, so you can see the rise and fall associated with each date. The first 2 cases of COVID-19 were identified in the county on March the 7th, 2020. And once community spread became evident, a spring surge of cases quickly followed. Monco became the epicenter for the virus in Southeast Pennsylvania. After the spring peak on April 24th, 2020, our numbers came down very quickly as we got a handle on the situation. By June the 17th, the 7-day average of cases dropped to 26.7, and we recorded only 35 positive tests on that date, indicating our summer low. Our numbers came down and they stayed down until the fall and right before Halloween. And then all the holidays came, and that has been a very challenging time. For months, we were in a great place. The fall and winter holidays were just devastating for us. Our worst days were after Thanksgiving. As you can see, the fall 2020 peak was December the 7th. And now we are seeing happily a steady decrease in the 7-day average. As of Sunday, March the 7th, 1 year later, we are at an average of 105 cases per day over the last 7 days. We are hopeful that this trend line will continue to stay on the decline, and we will continue to see suppression of the virus in both our community and in our data. Although this chart represents a somber milestone in our fight to end the COVID-19 pandemic, I remain hopeful for the future. We now have 3 safe, highly effective, life-saving vaccines approved for use, and we continue to ramp up our vaccination efforts here in the county. Our 2 mass vaccination clinics remain on track and have been fully operational this week with first and second dose clinics. Monco received all necessary second doses of Moderna for this week, and our first dose clinics are running smoothly, administering the Pfizer vaccine. We continue to remain flexible to provide both the Moderna and Pfizer vaccines at our clinics, and when the state is ready to provide us with Johnson & Johnson vaccine, we will be ready for that too. We are also ready to open a 3rd mass vaccination site near the Willow Grove Mall, but that is dependent on receiving more vaccine. Our team was optimistic that we would be able to open this site next week. However, that will not be the case. We just do not have enough vaccine to expand our operations right now, but we are hopeful that that will change in the coming weeks. One bright spot is that our teachers and school staff members will be able to get vaccinated as part of the state's allocation of the Johnson & Johnson vaccine. Here in Montgomery County, the Montgomery County Intermediate Unit is working with our Pennsylvania National Guard to vaccinate teachers and school staff. The MCIU is receiving a direct and totally separate supply of the Johnson & Johnson vaccine. This will not impact the supply of Moderna or Pfizer being received by the Montgomery County Office of Public Health. We are very happy that this operation will begin soon and will start our school districts on the path of safely or continuing to safely return to in-person education for our students. I do just want to point out that this program is not under the county's purview. So if you do have any questions about this particular program, teachers should talk with their school principals or reach out to the Montgomery County Intermediate Unit directly. Now, this week, the CDC released guidance on what fully vaccinated people should consider when they visit with others. First, you are considered a fully vaccinated person only after 2 weeks have passed from the time that you received your second dose of Moderna or Pfizer vaccines, or your single dose of the Johnson & Johnson vaccine. So again, it's 2 weeks after you got either that second dose or your single dose of Johnson & Johnson. Once the 2 weeks have passed, fully vaccinated people can visit with other fully vaccinated people indoors without wearing masks or physical distancing, visit with unvaccinated people from a single household who are at low risk for severe COVID-19 disease indoors without wearing masks or physical distancing. However, we really want to make sure that people understand that this should be just a very small number of people. And again, that group should be contained to a single household. Fully vaccinated people can also do not need to quarantine or be tested following a known exposure to COVID-19 unless they develop symptoms. For now, fully vaccinated people should continue to take precautions in public, like wearing a well-fitting mask and maintaining physical distancing, wear masks, practice physical distancing, and adhere to other prevention measures when visiting with unvaccinated people who are at increased risk for severe COVID-19 disease, or who have an unvaccinated household member who is at increased risk for severe COVID disease. Please wear masks, maintain social distancing, and practice other preventive measures when visiting with unvaccinated people from multiple households. Please continue to avoid medium and large-sized in-person gatherings. If you do start to experience COVID-19 symptoms, even though you've been fully vaccinated, you should go ahead and get tested just to be clear about what's going on. And continue to follow CDC and Health Department travel requirements and recommendations. So moving on to our COVID-19 hotline and phone pre-registration. Pre-registration for the COVID-19 vaccine remains available by phone through our COVID-19 hotline, and you can see the number on your screen. It's 833-875-3967. Our Office of Senior Services has implemented this service for people in the county who need support pre-registering for vaccine appointments by phone. To pre-register, just call by phone, and again, that number is 833-875-3967, and let the agent know that you need support to pre-register for a vaccine appointment. Once we have your information and it's in our system, it will be placed in line to receive an appointment. When we have vaccine for you, a volunteer will call you back and book that appointment for you over the phone. So you do not need to have internet access or an email address to use this system. For those of you who have already pre-registered on our site, we continue to send weekly emails to keep you updated on our vaccination progress and what you can expect when it's your turn. So let's take a look at that chart that has our updated data. We've been working through our individual pre-registration list and continue to vaccinate roughly 5,000 people per week. We are also cleaning up the list and removing people from our list that have received their vaccine elsewhere. As of this morning, we have 137,191 people remaining on our 1A pre-registration list. To date, we have sent 55,397 appointment notifications, so we are making good progress. At this time, and depending upon when you registered, it may take up to 12 weeks before you hear back from us about scheduling an appointment. That assumes our current rate of vaccine supply. We continue to hope that that supply will increase, But at our current 5,000 doses a week, it could take that long until you hear from us. Just as a reminder to check on your progress, you can visit our vaccine page at www.montcopa.org/COVID-19 vaccine and click the link next to the blue flag that says Status of Vaccine Registrants. This link will take you to a chart that lists how many individuals pre-registered each day beginning January the 12th. If you know the date you registered, you can see how many people are ahead of you. Currently, we are registering people for vaccine appointments who registered on or before January the 14th. It took us a while to move past the more than 30,000 people who pre-registered on January the 13th. So we continue to ask for your patience as we go through this list. So let's just take a quick look at the chart. As a reminder, that top row are the doses that have been received by the County Office of Public Health only. So we have received at the county 45,320 first doses. As of yesterday afternoon, 36,262 of those doses have been administered. We also got a delivery of vaccine yesterday afternoon. So we currently have a little over 9,000 doses available to us. We continue to vaccinate a little over 1,000 people a day. We hope and expect to get additional vaccine next Tuesday or Wednesday. So by the time that comes, we'll have between 2,000 and 4,000 doses left, depending upon when that next delivery arrives. Moving on then to the left side in that middle box, as I said, we have a little over 130,000 people that have identified as 1A remaining in our pre-registration list. And we've offered appointments to 55,397 people, and we are working our way through January the 14th. We did have about 19,000 people sign up on January the 14th. So again, it will take us a period of time to get through that day. So in terms of how we're doing as a county, and again, this is data that we are pulling down from the State Department of Health's website, and this is the data as of this morning. In terms of partially covered individuals who live in Montgomery County, we are at 100,702. For those that have received both doses or fully covered, maybe with a single dose of J&J, we're at 55,474. That's a total of 156,176 people that have received either one or both doses of vaccine. If we look at how this compares to the percent of adults 16 years of age and over, because you recall we cannot give vaccine to anyone under 16, you can see that about 15% of people are partially covered, about 8.25% of people are fully covered. In total, we have 23% of our population that's eligible to receive the vaccine, having received one or both doses. We continue to be challenged by not having a clear picture of who we are vaccinating. And as we move over to the right side of the chart and look at the countywide race and ethnicity data, I do want to continue to encourage people to just please self-identify when you're making your vaccine appointment. As you can see, when it comes to race, about 1 in 5 people are not identifying their race. And when it comes to ethnicity, about 1 in 3 people are not identifying their ethnicity. This data is important to us because it is one of the ways that we can ensure that this vaccine is being delivered equitably. We want to make sure that we get vaccine to every community member in our county. And without this data, it's very hard for us to know if the efforts that we're making are working. So please, I urge people to just take a couple seconds and fill out those 2 questions. This data is only being used for our purposes to help us track how we're doing. It would not be used for any other purpose. All right, let's move on to our regular update. Since the March 3rd press briefing, we have 810 new cases of COVID-19 reported in the county for the dates inclusive of Wednesday, March 3rd through Tuesday, March the 9th. This is a daily average of 115.7 cases and brings us to a total of 47,891 cases. These are all positive cases as a result of a test for the virus, not from the antibody test. 17 of these are from long-term care facilities, 1 from the Montgomery County Correctional Facility, 5 from other congregate settings, and 787 from our community. This week's individuals are from 60 municipalities, but as you know, all 62 municipalities are home to individuals with COVID-19. Today's individuals range in age from 9 months old to 97 years old. And as always, you can check our updated graphics at montco.org/COVID-19. In total today, we have 412 females, 396 males, and 2 unknown. I'm sorry to confirm that 4 additional Montgomery County residents have lost their life to COVID-19, which brings us to a total of 1,235 deaths confirmed positive from COVID-19. These 4 individuals ranged in age from 54 to 78, and all 4 died at a hospital. Overall, we have 628 females and 607 males who have died from COVID-19. They have ranged in age from 25 to 106 years old. In terms of the racial breakdown of these individuals, we have 2 that identified as American Indian or Alaska Native, 34 Asian, 7 Asian Indian, 5 Asian Korean, 146 African American or Black, 641 white, and 400 unknown. The situation remains stable at the Montgomery County Correctional Facility. Routine antigen testing continues on a near daily basis for correctional officers, and any inmate at the correctional facility that has tested positive for COVID-19 is in isolation and stable without symptoms. Our positivity rate has continued a downward trend this week. Our 14-day average positivity rate is down to 5.05% as of Thursday the 4th, compared with 5.47% as of Thursday, February the 25th. And this is our 14-day positivity graph. A reminder, the orange line is the number of people that were tested on any particular day. And then the blue line is our 14-day running average. As a reminder, a positivity rate below 5% is considered suppression of the virus. This next graph shows our daily positivity rates for February 5th through March 4th and shows that the county fell below 5% on 8 of these days in the last 2 weeks. So this is great progress. We're almost down into that suppression range. Prior to where we are now, the last date that we were below 5% was November the 4th. In terms of hospitalizations, our hospitalizations continue to remain high, but also continue to improve. Today, we have 110 individuals who are hospitalized in the Montgomery County Hospital with COVID-19. This is decreased from 121 last week. 14% or 15 of these individuals are requiring a ventilator. Our hospitals remain busy, so we shouldn't take this downward trend as a sign that things are over. To put this in some context, on October the 1st, there were only 24 patients hospitalized with COVID-19 in a Montgomery County hospital. So we still have quite a ways to go to get back to where we were before the holidays. In terms of testing, for the 14-day period ending March the 4th, 36,832 Montgomery County residents were tested for COVID-19. This is an increase of 1,114 people tested compared with the 14-day period ending February 25th. Just as a kind of interesting historical note, as of yesterday the 9th, so we're talking about basically a year's worth of testing, There have been 792,242 tests for COVID-19 performed on Montgomery County residents since the pandemic began. And those are tests for the virus. So there's almost enough for every person who lives in the county, which is 830,000. Not quite there, but we're certainly getting close. So let's move on to our date tested graph. As a reminder, the gray bars are the number of positive cases on any given day. The red and the pink are the 7-day and 14-day averages of cases from any source. The dark blue and light blue are the 7 and 14-day average of cases just from community members. And then down at the bottom, the orange and the yellow are the 7-day and 14-day average of long-term care facilities. And next, we'll zoom in on these last couple of months. And you can see, obviously consistent with all of our other data, that all of these numbers are moving in the right direction, but we are still not back to our sort of summer, early fall baseline. And we're getting closer, but we're not quite there yet. We do continue to have good availability of testing. So as always, I want to urge anyone who wants or needs to be tested to please get tested. Our sites are open Monday through Friday with varying hours each day, so please be sure to double check. You can register online for an appointment that day at any of our sites at montcopa.org/COVID-19 by clicking on the green County Testing Information button. And those appointments open at 7 a.m. on the day of testing. You can also register by phone at 610-970-2937. You can register for any of our sites beginning at 8:30 in the morning. And if you do call by phone, there is language line available if you wish to use it. One announcement for today from me, and then I'll turn over to Commissioner Lawrence. We continue to host virtual COVID-19 town halls to answer your questions and concerns about the vaccine. The next town hall will be on Tuesday, March the 16th at 7 p.m. We are partnering with the Asian American Coalition for a virtual COVID-19 vaccine town hall. The town hall will be at 7 p.m. and registration is available at montcopa.org/register. As a reminder, there's no cost to attend any of these events. Registration is open to everyone, and we have recordings of our previous town halls available on the county's YouTube channel. So those are there in case anybody wishes to watch. And with that, I will turn over to Ken Lawrence.
All right. Thank you, Val. I just have one announcement today. I mentioned it 2 weeks ago, but starting on Friday, March 12th, the hospitality industry can apply for our Montco Strong 2021 Hospitality Industry Recovery Program. And this is for businesses negatively impacted by COVID-19. They can apply for up to a $50,000 grant funding through this program. And this program is being funded by a $9.4 million grant from the state to provide grants to eligible businesses. In 2019, tourism and hospitality accounted for approximately 4% of all jobs in Montgomery County. And we know because of mitigation measures and limitations on travel and gathering, the hospitality industry has been one of the hardest hit sectors of our economy. These grant awards will be in increments from $5,000 up to $50,000. The eligibility, application requirements, and program design were all developed from Senate Bill 109, known as Act 1 of 2021. Eligible businesses must have their primary business activity in North American Industry Classification System, NAICS, subsector 721, which is accommodations, or subsector 722, which is food services and drinking places. And as I mentioned, the application window will open at noon this Friday, March 12th. Interested applicants are strongly advised to review the program guidelines in advance to ensure eligibility and to prepare to apply when the application window opens. Program guidelines and instructions are available in English, Spanish, and Korean. And there is also an instructional video which walks you through the application process and offers tips and suggestions to ensure a complete application. And that's about 7 minutes long. The frequently asked questions section of the page will be updated regularly. This is not a first come, first served program. Grants will be awarded on a rolling basis, and the application window will remain open until grant funds are fully allocated. So make sure you take your time and allow enough time to fill out your application completely and correctly. This program is being jointly administered by the Montgomery County Commerce Department and the Redevelopment Authority of Montgomery County. Questions regarding the program may be submitted through the Commerce Department's Assistance Request Form on their website at www.montcopa.org/commerce, and you can find all the information that I just shared there as well. And due to the large amount of applications expected, feedback on individual applications will not be provided. Turn it back to you, Val.
All right. Thank you, Ken. With that, I'll remind everyone that our next briefing will be next Wednesday, March the 17th at 1:30 p.m. And I'm happy to take questions.
Thanks, Commissioner. We'll start our questions with Teresa Shoemaker from the Intelligencer.
Thank you for taking my questions. I do have 3 of them. The first, just a clarification. The 5,000 doses a week, that's both first and second doses, correct?
No, that is first doses.
Just first doses. Okay.
Yeah, we deliberately have not been giving the numbers of our second doses because we want people to just be clear what we have in terms of first doses. But we have been getting all the second doses that we have asked for and needed.
Okay. And how much more do you think you need from the state to open Willow Grove?
We would need, well, at full capacity, we could give 4,000 to 5,000 first doses per day at that site. But if we could get even enough to do 1,000 per day at that site, we would open with that. So really about double of what we're getting right now.
And can you talk, final question, can you talk a little bit more about the mobile outreach? How many people have you reached with that, and who is being targeted?
Sure. So we're in our second week of mobile outreach. We're doing approximately 400 to 450 individuals with that outreach. We have started with a list of about 35 or 36 senior living communities where the seniors that live there are income qualified to live there. So these are often individuals that don't have great internet access or good transportation or other challenges. So our goal is to get through those locations first. And then remember, we'll have to go back and give that second dose. But once we're through these original locations, we'll start to work in other community-based locations. We've had a number of requests, and we have a long list of churches and community groups and other places. And so we very much look forward to being able to get to some of those places as soon as we get more vaccine.
Thank you very much.
You're welcome.
Next, we'll go to Carl Hessler from the Pottstown Mercury.
Good afternoon, commissioners. I'll follow up on the mobile vaccine questioning there. I received a call from a county resident who has a family member who suffered a traumatic brain injury and is disabled, cannot get to a mass vaccination site. What should that individual do in order to get a vaccine? It sounds like the mobile vaccine program would not be available to serve them right now because you're going to these congregate settings. But what could that person do if they want that vaccine right now? What could they do? How could you help them? And others like
the first, yeah. So what I would recommend in a situation like that is there is probably a provider that is providing care in the home to that individual, hopefully. And I would reach out to them to start to see if they have been able to obtain vaccine. But we are very, very aware that there's a number of homebound individuals in our county. And as we get more vaccine, we are eager to try to reach as many of those people as we can, or work with their typical providers to make sure that we can get vaccine to them. Right now, in the situation that we're in, with a very limited amount of vaccine, and knowing that there are the very contagious British variant here in our county, our goal has been to go to congregate settings so that we can get as many people vaccinated as quickly as possible. As we get more vaccine, we are prepared to put more teams out there so that we can start to then work on some of these one at a time type situations, which obviously in the course of a day, we can do very few of those compared to what we can do at a larger, more congregate setting or at one of our mass vaccination sites. But would reassure that individual that we know that people are out there, and it is absolutely high on our priority list as we get more supply to work to get to all those individuals who are homebound.
Okay. Different subject. In light of the letter that regional leaders sent to the state health department earlier this week, questioning the vaccine distribution in the Southeast region, have you heard anything from the Department of State regarding the formula that they use to distribute the vaccine?
There has been no official response to that letter that I'm aware of. And the county has received this week the same amount of vaccine that we received for the last several weeks. So there's been no change in our allocation.
When you had the meeting with them on Sunday, did they explain a formula to you, and what was that formula?
Well, they showed us a graph. I don't really know that I can adequately describe it. They described verbally what went into that graph, but they didn't give us any of the data behind the graph. So I personally found it difficult to interpret, and I continue to ask for just simple transparency here. We just need a chart with each week of the year since vaccine's been coming, and where it went to which counties, just so we have some sense of this algorithm that they're using. They have described the algorithm in words. I can tell you what the 4 components are. It takes into the population of the county, people that are 65 and up, how many deaths have been in a county, and how many cases have been in the county. But they haven't explained how they actually apply that index. So I'm sorry to not be able to answer your question, Carl, but I can't answer your question because I don't have the information from the state, and it's been enormously frustrating, and we're just asking for simple transparency here.
I would encourage everyone to ask the Department of Health to explain it. And if you all understand it, then you could explain it to us. It was as clear as mud. And we've gotten no follow-up or transparency since.
All right, those are my 3 questions. Thank you.
Thanks, Carl.
Next, we'll go to Maria Pulcinella from WHYY.
Hi there. Carl sort of stole my thunder, asking about the meeting earlier this week with regional health leaders. I guess the only thing I would add on to that, there's obviously a clear need from the collar counties for more information, for more transparency from the state. At this point, what are the next steps moving forward? Like, do you have, confidence that the state, can meet these needs, I guess, moving forward?
Well, the next steps are in the Department of Health's court. We have 2.5 million people here in the 4 suburban counties. There's 1.5 million people in Philadelphia. We have 2.5 million surrounding Philadelphia. And our goal is to get people safe, to enable people to go back to work. We all know that our workforce flows back and forth between all of our counties, And we provide an enormous amount of tax revenue to the Commonwealth. So it is critical that we get this area vaccinated. As I said, we got the same amount of vaccine this week as we got last week. I'm not sure what the status is with our neighboring counties in terms of what they received this week, but we are still waiting for a response from DOH. We asked for 3 very simple things. We asked for them to be fully transparent with the data so we can understand how these decisions are being made. We asked them to give us the plan for how they're going to bring at least 2 of our counties in our region who seem to be, even by the state's data, undersupplied. And 3, we've asked them to commit to not letting any other county move on to the 1B category until all of us here, well, really any county in the Commonwealth has received enough vaccine to vaccinate their 1A people who wish to be vaccinated. Because it's my understanding that there are counties in the Commonwealth they've gotten so much vaccine, they're about ready to move on to another stage potentially, or could be able to do so soon. And I just don't think that's fair or equitable. I think we need to make sure that everybody has had a chance to get through their 1A individuals and that we move on to 1B as a state.
Got it. Thank you so much.
Our next reporter will be Todd Shepard from Broad and Liberty.
Commissioners, as always, thanks for making yourselves available. As we all know, it was 3 weeks or 4 weeks ago that we learned that there was the mistake with the many of the second doses being provided as first doses to some people. Could either of you speak to how much has that complicated things in the month since we learned that? And are you still dealing with that issue now, or is it pretty much behind the county?
Well, in terms of the doses received by the Montgomery County Office of Public Health, my team has been meticulous in accounting for each of those doses and properly classifying it as either a first or second dose. So from our mass vaccination clinics, we have not had any problems at all. Thankfully, we have received all the second doses that we asked for. And so we have not had any problems ourselves. However, there are a number of individuals in our county who received their first dose at a pharmacy and had been told by various pharmacies that they would not have a second dose available to them. We did communicate this to the state. We were, as much as we could, gave them specific names of pharmacies that didn't seem to have any second doses. And it's my understanding that some of those locations have received their second doses and they have been able to vaccinate some of their people. So it seems to be improving slowly but surely. So hopefully that most of those places will have gotten some second doses and be able to take care of all the people that they gave those first doses to.
Would you be able to put any numbers to some of those items that you just spoke of, such as like how many of those people you were at least able to first identify? I'm sure tracking them since then has been difficult.
Yeah, I really couldn't. Those concerns from constituents have been coming in a number of different ways. So I don't even know that anybody on my team would be able to pull that number together.
Sure, I understand that. Back to the issue of the county's communication with the state and so forth, because this has been very public, at least since Monday, since you put out, the 4 counties put out the press release. Have you heard from counties outside of the Southeast where maybe they've been able to tell you what they've experienced so that it would give you more insight into how the state is proceeding? Or, have you had other elected officials that aren't in the 4 county area that have tried to provide you some assistance, and can you describe that?
I personally have not. Have you heard from
Berks
anyone?
County has reached out not to provide assistance, but to share the same concerns and frustrations that that the 4 counties have as well. So, but no one's reached out to provide assistance. I just think other counties are now asking questions as well.
Thanks very much. No further questions for me.
Thank you.
Next, we'll go to Justine McDaniel from the Philadelphia Inquirer.
Hi, Commissioners. A few questions on the issue with the state as well. First, the state this weekend kind of seemed to indicate a pivot in philosophy, saying that now the vaccine administration rate is really what we should all be measuring success by. So I'm curious if to you, does that represent kind of a departure from the state's previous messaging about how we're measuring success? And if so, do you think that this is the right metric to be using, or is this kind of just trying to, maybe change the conversation or change their messaging, I guess?
Yeah. So I have a lot of concerns about using the metric of the percent of people in a particular county that have been vaccinated for a very simple reason. That measure does not in any way account for equity. So it's quite possible that when a person has a good computer or good computer skills, time on their hands, and good transportation, they can find a vaccine dose somewhere in this state. And if they've got the time and the car to get there, they're able to be vaccinated. The people that don't have those things are really stuck. And if we don't have enough vaccine here locally, there's no way that those people who are working all day, maybe don't have a car, maybe don't have the ability to hop online, every 30 minutes and check to see if some pharmacy put more appointments out. They're going to be stuck, and they are not going to be able to be vaccinated for a long time. So I think they're focusing on the wrong thing. I think they need to be looking at how many people, how many doses are coming to these counties using fair and equitable measures. There are many measures they could be looking at. There are indices of poverty, other population demographics, people that work in certain sectors that are extremely high risk. There's lots of ways they could be approaching that. And I don't think that looking at just simply how many people have been vaccinated is a fair measure at all.
I want to echo that. It's just flat out wrong to say that the vaccination rate makes it okay. We absolutely know that we've had citizens who have gone to Lehigh County, they've gone up to Scranton to get vaccinated, and that's great. But we know that we have vulnerable populations here in Montgomery County where they don't have access to the internet to make appointments, and they don't have the transportation to get other places. And for those populations, as Val said, they need vaccine close and within their communities, and that has not been happening.
Great, thank you. And my second question, the state told us yesterday that they can't actually monitor whether providers are vaccinating ineligible patients because the individual vaccination reports don't show age or anything else that would indicate eligibility. So they're really only responding if they hear about a complaint. They are not monitoring the providers, continuously for that. I'm just curious if that's also your understanding of how those vaccination reports work, and if so, are you concerned about enforcement?
That is not my understanding, and we are trying to get you confirmation on that particular question. What I can share with you, as the people who have been vaccinated know, when they make their appointment through PrepMod, there is demographic data collected. That is where that race and ethnicity data is collected that I mentioned earlier. And I believe that age is collected too. I'm almost 100% certain of it. The question is, does all of that get loaded up into the Pennsylvania SIS system, which is the State Immunization Information System? The acronym is SIS. So we are checking on that to give you some certainty to the answer of that.
Okay, thanks, Commissioner.
Next, we'll go to Stephanie Stahl from CBS 3. Stephanie, you are still muted right now if you're trying to speak.
Thanks. I don't have any. Everything's been covered.
Muted right now if you're trying to speak.
Thanks. I don't have any. Everything's been covered.
Next, we'll go to Teresa Brown Paris from Montco Media.
I just have one follow-up question in reference. Thank you. Sorry. I just have one follow-up question in reference to clarification as far as the vaccine that's available at like the CVS stores. Is there any restrictions as to if in the, let's say if it's in Norristown, only Norristown residents can get those vaccinations? Is it specific?
So the CVS drugstores, for the most part, are getting vaccine from the Pennsylvania Department of Health. If they get their vaccine from Pennsylvania Department of Health, they are supposed to be following the Pennsylvania Department of Health guidelines, which say that you should not turn away anyone for vaccine based on where they live. They do have to be in the 1A category right now, but we've all been told that we are not to turn away people based on where they live. And I believe that some of these drugs pharmacies are getting vaccine directly from the federal government at this point. And I believe that the guidelines are the same because it is a federal program, that they are not to turn away people based on where they live, but they do have to be in the 1A category.
Okay. All right. Thank you very much.
Mm-hmm.
Finally, we'll go to our communications director, Kelly Cofrancisco, with a question from Justin Hines from Patch.
Thank you, Todd. The question is that Philadelphia Health Commissioner Dr. Farley said he thinks it's possible that the city could reach herd immunity by June. And he says, I know it's a rough estimate, but do you think that Montgomery County is on a similar timeline? And does the county also consider herd immunity to be a 70 to 80% vaccination rate?
So I would agree that I would imagine we'll be seeing the impacts of herd immunity around 75 to 80% of people being vaccinated. That is at least what the CDC has been saying now for some period of time. We are working on trying to determine when we might get there. So that will be a combination of the number of people who have been fully vaccinated, coupled with people who may have had COVID in the recent 90 days. You know, it does look like most people have antibodies for at least 90 days after having COVID. So the herd immunity will be a combination of those two things, although we really want to focus on those that have been fully vaccinated. That is definitely going to give us our strongest immunity. So my team is actually working to try to project that out. We don't have that number yet, but we might in a week or two be able to give that number to you, or that best guess, I should say.
Thank you. I don't have any further questions.
All right, great. Well, thank you, everyone, and we will see you next week.